my hope is that by the end of this conversation, people will start thinking about creatine as getting it out of the gym bag and into the medicine cabinet.
Keep in mind, at the age of 40, you start to lose skeletal muscle. Not only can creatine resistant training maybe halt that, I think an older adult would say, I'm buying that. Well, first off, vegans probably respond the second best in the world to creatine supplementation. Those on a carnivore diet would likely experience the least benefits.
Welcome to Medicine Redefined. I'm Dr. Altamash Raja.
And I'm Dr. Darsh Shah. Let's put the health back in healthcare.
Before we dive into today's conversation, I have an exciting update. My new practice, Refining Health and Performance, is officially launching soon. It's a practice built around health, longevity, and performance, the Medicine 3.0 approach we talk about every week here on this podcast. And here's the best part. It's a telemedicine clinic, so you can work with me from the comfort of your home. Our founding member enrollment is now live, so if you'd like to learn more or join the waitlist, visit refininghealthrx.com. All right, let's get into the episode.
Dr. Darren Candow, welcome to the show.
Thank you so much for having me.
I'm so excited, as we were just talking about, to get right into it. And my hope is that, what I'll just say is I think people, listeners of the show, recognize that both Darsh and I have been talking about creatine for a long time. And I think for those of us in the know, particularly with the exercise science, ex-phys background, we've probably crowned creatine as the undisputed champion when it comes to supplements from a muscle physiology, performance, strength, power standpoint, right? With respect to safety and efficacy out of all supplements, maybe caffeine if we're counting that as one too. However, my hope is that by the end of this conversation, people will start thinking about creatine as getting it out of the gym bag and into the medicine cabinet.
Right.
So with that, I'd like to kind of start with getting a little bit about your background in terms of how does someone devote pretty much their entire career to one molecule? How do you even get into that?
By accident. So this is a unique story, and I think a lot of researchers are in the same boat. So I did my master's degree looking at glutamine, and at the time, glutamine was touted, and this was in 1999, 2000 when I started. At the time, glutamine was the newest thing on the block, so to speak. A lot of endurance athletes were using it, for the anti-catabolic effects that were coming out in animal models and sepsis and cancer. And it's a non-essential amino acid, but if we give a flooding dose, could it actually have some beneficial effects as the most abundant amino acid that we have? And, you do all the work leading into your master's, as you guys know, and then you write your thesis and then you recruit subjects and you give a really high dose. And at the time, I think it was about 45 grams a day, very expensive because we wanted to see the effect. And you do DEXA for body composition and strength and power in young individuals. And compared to a placebo, it had no effect. It was essentially worthless. It had no greater effect on lean body mass, muscle performance, or a measure of protein breakdown. And at the same time, by doing that, my colleague, Dr. Darren Burke, who's in industry right now, was looking at creatine monohydrate. And keep in mind, 1992 was when Roger Harris published the big paper on creatine, and Eric Holtman came out in 1996. So just a few years later, my colleague and mentor, Dr. Phil Chillibeck, were getting interested in creatine monohydrate. And we started to know or see that individuals, independent of what they were taking, were getting bigger, stronger, faster. And when you find the results of unblinding, that those on creatine substantially improved lean mass, measures of muscle cross-sectional area, and performance more than placebo. So I started to pivot and sort of help out in those studies because I was quite fascinated that this naturally occurring compound that's been discovered since 1832, it was actually discovered before ATP, sacrifices itself to help maintain the energy currency of our cell. And it's sort of exploded ever since. So the last 2 decades, I've been primarily focused on creatine supplementation, not just for young athletes, the evolution now for aging population. So my dissertation was on the aging population, and it's quite interesting how it's evolved from just skeletal muscle. Now we have interest in bone, cardiovascular system, and of course the brain. So I like your analogy at the beginning, just getting away from the gym bag to something that's sort of taken the world, if you will, by storm. I think we need to tone down some of the expectations or results. I think they're getting a little bit blown out of proportion, especially around the brain. There's a lot of nuances when it comes to females. There's no such thing as female creatine. I'm not convinced females respond better or worse off than males when you look closely at the cellular data. So we can talk about all these nuances out there, and hopefully I can provide a evidence-based research approach to it. Yeah.
Let's start right there, because in prep for this, as I had looked at some of your other work, I actually took 20 grams right before I started this right here, right? Because I wanted to be fired up on all cylinders. So what is it that we need to maybe turn the dial down, and maybe people have gotten a little bit too excited, too hyperbolic? And what's this female creatine that you're talking about?
Yeah, so let's start with this. I think one of the biggest concerns right now, I mean, we can talk about myths and misconception, but the studies that seem to be evolving around the brain are suggesting that a super high dose, or much higher than what most people are used to, except for those that have tried the loading phase. So a creatine loading phase is 20 grams a day for about 5 to 7 days. That's way too long to saturate your muscle, but it's often used in research studies. And after that, you can reduce it as little as 2 grams a day to maintain skeletal muscle stores. Keep in mind, there's about 80% already full capacity of your muscle. So supplementation only has about 20% to work with. The brain is unique. It has a blood-brain barrier. It also makes its own creatine. So on days that you're not stressed, if you're getting adequate sleep, proper hydration, you don't have any big metabolic stressors, I hate to burst everybody's bubble, but taking a supplement is not going to have any noticeable effects. Your brain's already making enough. So a lot of people think, when they hear me or others, we talk about what we consider acute studies of metabolic stressors. So to piggyback, if you are in an unstressed population for extended periods of time, laying on the beach in Mexico for a vacation comes to mind, you're not going to get any cognitive benefits from creatine. However, during acute metabolic stressors or disease, that's the best lines of evidence, where a higher dose is likely needed to get through the blood-brain barrier and then overcompensate for what you're endogenously making. So for example, your brain is already making about a few grams of creatine. Is that enough when you're sleep deprived? If you suffer a concussion, stroke, Alzheimer's disease? Likely not, because a common denominator in the pathophysiology of those diseases or head trauma is a reduction in brain creatine. So maybe then the brain says, I need help from circulation. It will allow more creatine in or accumulate more. The best lines of evidence for creatine and cognition seem to be at higher dosages. 20 grams or more seem to be ideal. Or you could take 4 to 5 grams a day, but it needs to be on for several months to accumulate. Those studies come from clinical depression and long COVID. But for the healthy individual, 20 grams a day, at least 7 days, if not longer, to compensate in the brain. So I use the analogy of me. If I fly to Europe, I'm very susceptible to jet lag and sleep deprivation. That's where a high dose might come to the rescue. Your viewers will say, well, how will I know if I'm going to suffer a metabolic stressor the next day? You don't. So I kind of look at it as a preventative strategy. We can talk about the rodent and mouse model for concussion, but I think if you're taking slightly higher amounts than what's recommended, it kind of acts as like a safety barrier for when you do have to go through those stressors. Your dog got you up in the middle of the night, jet lag, sleep deprivation, God forbid if you suffer trauma. So I think during times of metabolic stressors, that's when brain creatine may benefit from supplementation, but every other time it's likely not.
Darren, do you mind breaking down exactly what type of physiologic effect a metabolic stressor has, right? So our listeners and us know that creatine helps with energy production, right, in the gym before doing a big bench press. How is it working physiologically in the brain? What exactly mechanistically is happening?
Totally. So let's start with skeletal muscle. You go to the gym, you lift weights. The next 36 hours, you typically can feel some type of strain or muscle soreness. So that's usually accepted. We typically don't feel that exact same amount in the brain, but it's very similar. So creatine supplementation increases phosphocreatine, which enables more ATP to be used or recycled, not only in skeletal muscle, but very active in the brain. A lot of people know that the brain is highly metabolically active. It's more active when you're stressed. So that is a common denominator, just like skeletal muscle. It increases brain bioenergetics. But elegant work out of the rodent model has now shown 2 classic mechanisms why we think creatine acts as a fire extinguisher to decrease the flames of the brain when it's stressed. So think of creatine acting as a fire extinguisher, putting out the smoke. It decreases reactive oxidative species, as 3 of us know, and everybody probably watching, highly involved in aging pathologies of the biological process of aging. It also acts as an anti-inflammatory. So it not only improves mitochondrial health or function, it seems to have some anti-inflammatory effects there. So the net result is, yes, it can help maintain brain bioenergetics, but it sort of rescues or decreases the inflammatory response, allowing the tissue to recover more. So if you have a slightly elevated amount in reserve in the brain, when you go through those stressors, maybe you will be able to recover more. So that's been elegantly shown in the mouse and rodent model, where they consume creatine for 3, 5, and 40 days before they went through head trauma and concussion, and they had 50% reduction in cortical damage. Can a professional athlete in the NFL, NHL take creatine before head trauma? That begs the question, would that speed up recovery or decrease the symptoms? That's the area that I'm really fascinated with. Can creatine be sort of like a prophylactic for UFC, boxing, Sidney Crosby on the Penguins when they've suffered head trauma? Can they speed up? What about children? When they're falling off their bike, or an older individual falling at home, they hit their head. Diagnosis of concussion is very difficult to do. Could this metabolite, taken in slightly higher amounts than what we're naturally producing, have any beneficial effects? We certainly hope so. More research needs to be done, but I'm not seeing any detrimental effects. There's never been a study to suggest that a higher amount has any brain adverse effects. They still need to be looked at, but I would be, we're only talking about 10, 20 grams. If we were talking about protein, we'd be talking about hundreds of grams. So again, it's a small amount. And I think in certain populations, you should at least consider it. I personally just take 10 or slightly more. So that's a bit different. 3 to 5 is great for muscle. 8 to 10, 8 to 12 is good for bone. I think the sweet spot is 10 for the whole body, because I do believe 10 can get into the brain and potentially, if you take it on a daily basis, accumulate to cause those benefits. But if you're a university student listening and you're like, oh my God, final exams are coming up, I have 3 finals on Friday, I'm not going to sleep all night, and you're up for over 24 hours, classic study last year out of Germany said that 30 grams taken before 21 hours of sleep deprivation elevated brain creatine. It was the first study ever to get into the brain in one dose, but offset the detrimental effects of memory and cognition. So I think these are unique populations where if it's coming, you can slightly prepare yourself. Can 30 grams a day be taken consistently? I don't think so. I think you would run into some GI issues or some other complications from consistency. But if I'm flying to Germany next week and I know I got to drive to the airport, wait at the airport, fly overnight, which I can't sleep, then you get off in Paris and maybe you're going to Italy, you're up for 24, 36 hours. That brain fog is detrimental. And that's where I think creatine can come to the rescue there. So there's lots of examples. If you're healthy, you're going to experience anything. If you're stressed, that's where I think it can help.
Yeah. And that study that you referenced right there with sleep deprivation, that was an acute sleep, right? One night.
One night of sleep deprivation. And now they've also looked at it for 36 hours, 20 grams a day, a lot lower. It didn't have the same beneficial effects as this one. And again, these 2 studies, or the one from Germany that did 21 hours, they're using MRI and MRS. So super expensive, elegant, the technology to sort of measure differences in brain creatine. The big downfall with brain creatine research right now is not a lot of labs have that. So they're subjectively measuring memory and cognition, but you really need to measure brain creatine, and then how does that associate it with changes?
Yeah. When I first read that a couple of years ago, I guess, when it first came out, I got super excited. And, my initial thought was, okay, well, what about medical residents who are going through a stressful time where you're pretty much sleep deprived for 3 to 5 or 7 years if you're in a surgical residency? And I've talked to Darsh about this offline. It's like, or new parents.
Yes.
Right. Especially if your kid is not a great sleeper, it's like being on call and never coming off of call. And then, at that point, I would wonder at 25 grams or 30 grams, can you take that for years on end? We just don't have that data. And it also gives me a little bit of pause at that point.
We have studies in Parkinson's that are up to 5 years on a high dose. But the good news to your analogy is 2 studies with clinical depression out of Utah, the world's leader in psychiatry research with creatine supplementation. These individuals were on SSRIs or did CBT therapy, and only 5 grams was significant for 8 weeks. So there's the key. Lower dose, but you need to take it longer. But I think 5 grams is very feasible. Take that on a daily basis. It did elevate brain creatine stores, and it also improved or decreased symptoms of depression and anxiety. For those with long COVID, Serge Ostiak showed that 4 grams a day for 3 and 6 months was enough to accumulate into the brain. The common denominator when you talk to the authors is that maybe in those cases, the brain is begging for help. Long COVID, chronic fatigue syndrome, depression. And of course, the individuals in the studies on depression were on their medication. So creatine has never been shown by itself to have any antidepressive effects by itself. I'm sure those studies are coming. But for those listening and you fall into the metabolic stressor category, if you say, you know what, I just want to go with 3 to 5 grams a day, I think you'll eventually get there. They may not come to the rescue as fast as you want, but if you know you got a big thing coming up, there is evidence to suggest at least you could consider it.
Yeah. What part of the brain is it made in?
Well, this brain is made in various functions. The one we think is the prefrontal cortex seems to be the area where phosphocreatine seems to accumulate the most, which is great for memory. The cerebellum and thalamus, and Paul Duchenne did probably the most overlooked study of all the ones published in 1999. He was the first to show in Germany that a single dose of creatine, 20 grams, elevated not only total brain creatine, but in different regions of the brain. But you needed 4 weeks at 20 grams in a healthy population to accumulate. So that goes back to my idea. Healthy population, it'll eventually accumulate, but if you're stressed, it seems to suck it in a little bit more. Yeah.
Yeah. The reason that question has been bugging me a little bit is because when I think about, non-traumatic brain injury, and I'll put, anybody who's might have had a brain tumor and resection. Sure. I guess if you've had surgery, I would consider that still trauma. But if somebody's had a craniectomy or a craniotomy of some sort, and then a certain part of their brain has been removed, or they've had a large enough infarct where the neurons are dead there, and are certain parts of the brain that are responsible for making it, are those individuals something that you should just consider long term? Yeah. We have any thoughts to that, or?
Well, it's interesting. The oligodendrocytes, the glial cells, and neurons, and even astrocytes will express creatine, but the astrocytic feet don't. So that's why it's so blunted coming in. But you raise a good point. The only times we see are individuals born with creatine synthesis deficiencies that were AGAT or the other enzyme involved in synthesis. It's not causing a synthesis over time. And that's where supplementation really seems to come to play. So that's an interesting thought. If someone goes through a brain tumor, surgery, whichever, and some of the really healthy cells are removed, maybe creatine can offset or at least speed up the recovery. That's a phenomenal question and an area that certainly has not been looked at.
The one thing that actually, as I'm talking about this, is I guess if you've had a history of a brain tumor, is that an area where you would want to, and this is, we're just discussing, again, not medical advice. Anybody listening, please don't take it as such. But is that an area, would you want to supply something that could potentially give those cells, if you have a tumor that's been resected?
And again, this is pure speculation, but from the anti-cancer possibilities of creatine, which are emerging, the theory is there, maybe a higher dose could sort of act as a non-pharmacological from chemotherapy to other types of radiation. Could that have any extra anti-inflammatory effects to the cell? When we look at the anti-cancer properties, we're not seeing any growth from normal dosages in humans. Mark Tarnopolsky has written an elegant section in one of our recent papers on the potential anti-cancer properties of creatine. We're starting to look at that in South Carolina with breast cancer and prostate cancer. But from a malignancy growth, we're not seeing any evidence from a recommended healthy dose in human populations.
Got it. So you mentioned obviously a lot of overhype when it comes to brain injury.
Right.
What is something that would change your mind on that? What are you looking for with, the upcoming research? I know you mentioned that there's a paper that you're going to be submitting soon. Right. Tell us a little bit more.
Well, first off is when the lab actually measures brain creatine with MRS, they need to determine the minimal detectable change against our normal synthesis. They also need to determine, is creatine supplementation decreasing our natural production or augmenting it? And the third thing is, how does creatine supplementation get into the brain quicker compared to our natural recovery? So, for example, it is so difficult to design this study, except for the study that came out last year, because what happens is you want to randomize two populations that get head trauma to a placebo or creatine, and then measure the symptoms of concussion after. The problem is we used to think it would take a long time for creatine to get into the blood and accumulate to the brain until the study came out last year in Germany at 30 grams. That was a high enough dose to get in. So can someone going through head trauma as a prophylactic or that has suffered it take a super high dose? They can. They need to be medically monitored. But I think the big change is, does creatine increase brain creatine stores? And what's the correlation between improving symptoms of concussion?
Gotcha. Okay. And then in regards to the sleep deprivation, do we know when that dose has to be taken, that 20 grams? Is it right at bed or should it be split up for saturation?
The studies that looked at it was a short proximity before. So again, and it was, we don't know when we're going to hit our head or go through sleep deprivation. Can you take it late at night? You can. However, anecdotally, I've heard from numerous people. I mean, I would venture a guess 50 different people who say when they take creatine in the evening, they have insomnia. They're waking up all night. And so you speculate, is it because they're drinking a lot of water and they're going to the bathroom? But I will say from a biochemical perspective, creatine is the biggest methyl scavenger in the body. So if you take a high dose of creatine on an empty stomach or late at night, it's possible that the high dose is blunting the methyl scavenging, allowing more methyl groups to be there for what we call neurotransmitters and epinephrine. So sometimes people take a high dose of creatine on an empty stomach, for example, and they feel a little jittery. That could be from a number of reasons. But if you look at it from a sleep, it's interesting, the theory, I'm not ruling it out totally, that if you look at the methyl group scavenger, maybe some of that is influencing some people that they have intermittent sleep. On the contrary, we published a paper 2 years ago in menstruating young females who resistance trained. When they consumed creatine on the days they worked out, they actually slept an hour longer. So right now, we just don't know the effects on sleep. We're starting to have evidence on sleep deprivation. Yeah.
So 10 milligrams at baseline, at least that's kind of what you do, 20 milligrams in times of acute stressors. Now,
sorry, that's
we know that
10 grams.
Oh, sorry, grams. I apologize. Yep, 10 grams. Now, we know the muscle is really greedy, right? You've talked about that. Now, does the split of the dosing matter, or does it have to be 10 or 20 as a bolus for that brain to get it, if that's the tissue that you're targeting? Or can you get 5 and 4? Is there any art to that?
That is the magic question, and we're still surprised that it hasn't been done. So I'll sort of give you what we think. The dose out of Germany gave a bolus dose all at once, 30-gram shot. The problem with that is some of that will be residing or causing issues in the GI tract if you did that over time. A study out of Utah looked at 2, 4, and 10 grams. It had some small beneficial effects, but they weren't statistically significant. So the question is, can you take smaller, more frequent dosages compared to a large bolus dose? Do they have any differing effects in the brain? We don't technically know yet. I will say a study we did last year in healthy university students in Northern Iowa who took 10 grams a day or 20 grams a day for several weeks. There was no difference on measures of cognition. So right now, the evidence is unknown. We still need to do dosing strategies to come up with the optimal dose, not only for the brain, but the rest of the body. Now, it's impossible to do that. So that's why I'm suggesting 10 grams seems to be an average. Again, it's never been shown, but 10 grams seems to be a dose that you definitely will check off the box for skull and muscle. If there is any benefits to bone, it's likely around that 10-gram dose. And then 10 grams should accumulate into the brain when you look at the 4-gram all the way up to the high dose. So it's never been shown. Great question. And hopefully some research comes out with that over time.
Love it. So you mentioned bone health. Let's get into that. So from my understanding, and maybe this is new now, is bone health, bone density, once you hit the age of 30, 35 is actually very difficult to kind of put on, right? So they talk a lot about getting young athletes into more of the weightlifting to really start building that density. Creatine, of course, now has an effect on bone health. We're learning. Tell us a little bit more about how that works.
Yeah, so it's interesting. When you look at the bone remodeling process, osteoblast to osteoclast, the theory was that maybe creatine would serve as fuel for the osteoblast cells. And there was some in vitro studies to show that those osteoblast cells sort of use creatine for fuel. They become more energized. So the hope was, wow, maybe they could lay down more phosphate salts and calcium matrix. And then on the other hand, creatine seems to have a better effect from an anti-resorptive effect like a bisphosphonate. So a few studies have shown that markers of collagen breakdown in the urine were reduced when you take creatine with exercise. So you combine an improvement, hopefully, in osteoblast activity and an increase or decrease in osteoclast activity. Maybe an individual prone to bone-related diseases would benefit from supplementation. Unfortunately, there's only a few clinical studies combining resistance training and walking for 1 year and 2 years that have shown any beneficial effects on bone, primarily in post-menopausal females. There was a very small reduction in bone mineral density loss in the hip. Both males and females over the age of 50 did improve bone area below the knee. And then some measures of bone strength were maintained or improved. But keep in mind, that was only after 1 and or 2 years of exercise at a high dose, about 8 to 12 grams a day. The downfall here is the vast majority of other studies do not show any bone benefits, including meta-analysis reviews. So at the end of the day, we conclude that if creatine does have any bone benefits, they are small, but they're not to be ignored. I think in the population such as postmenopausal females, at best, we might conclude there's some evidence to suggest it might have an anti-resorptive effect. And that could be important for someone who's prone to osteopenia, falls, or fractures later on in life. It certainly does not increase bone density. At best, we think there's a preservation effect there. Creatine by itself will have no effect. Great studies out of Brazil showed 1 and 3 grams a day for 2 years had no effect. Exercise needs to be there to be the stimulus. And at the end of the day, would I take creatine for substantial bone health? No. But I think at the end of it, it's an added bonus if you do get any benefits.
I've heard you talk elsewhere about bone geometry, and that's a term that I wasn't familiar with.
Yeah.
Can you talk a little bit about that and in relation to this conversation, but also why is that important for us to be aware of?
Yeah, we call bone geometry or architecture. So now when you look at 3D imaging like CT scans, we're starting to get in trabecular and cortical bone. The downfall with bone-related studies with creatine, we measure DEXA. So again, we're looking at aerial composition of the bone, but with CT and high resolution, we can get inside. And it's the first time we introduce bone geometry or strength. So if you picture your pen, you don't want it to crack. So the bone is actually stronger. And it's really important from the WHO's perspective that an improvement in bone strength now is being really important for offsetting the rates of falls, fractures, and or frailty. So improving or maintaining strength, i.e. geometry, is an important factor.
Okay, very cool. So with respect to the other things, like, so we've talked a lot about, I guess the most exciting thing in terms of the evidence, if I had to summarize it for folks, with bone health seems like it's very preliminary. If there is maybe mild with cognitive brain health, it's a little bit stronger. And if we could actually specifics to come back to the brain health, I know we kind of put a bow on it, but when they're getting these outcome measurements, we're talking, is it recall, memory recall, what is the term cognition? What are the true metrics that actually that are improved with creatine supplementation for brain?
It's a very wide variety. I'm talking like Stroop tests. It's a test you can do online with a computer. They're looking at puzzles, memory, cognition, word recall. So when you look at all the studies, there's a wide gamut. So they sort of combine this into an overarching area called cognitive or memory benefits. Reaction time falls in that category again. So it's kind of like the Wild West. It's very open. There's no specific one. One of the most unique studies is when they did the Stroop test. And if you're not familiar with it, you can Google it and try it. And I only lasted 4 words, where you read the different colors of the words, which actually are in air. And they asked these individuals to do it for 90 minutes. And I can't even imagine the mental fatigue that these poor people had. And creatine seemed to improve memory and cognition after they did such a drastic, mentally fatiguing task. So it's a Wild West when it comes to these types of measures. But at the crux is what we want is an improvement in brain creatine levels. The best studies with skull and muscle measure muscle biopsies or use MRS to measure the amount of creatine getting into the cell. And then, of course, that's correlated with performance. So those are the really elegant designs we want to focus on.
I love it. So shifting gears a little bit, the other thing that's actually really having its moment, right? So I think creatine, like you talked about, menopause, appropriately so. And then, of course, the whole field of longevity. And Darsh and I are physiatrists, for those who are listening, as we were talking about, and I would say we're probably the original longevity experts, because we look at people with their quality of life and function, especially as they age and how healthy they can be. We recognize that obesity is certainly a big problem, but so is sarcopenia and being sedentary and muscle loss. So how or what has your research been, and what have you looked at in terms of when you look at the literature and its effects in reducing muscle loss and just, I suppose, more graceful aging?
Yeah, it's the biggest focal area of my research. So we're really focused on sarcopenia and then, of course, the contributing diseases after. So many organizations classify sarcopenia based on 3 things: reduction in muscle strength primarily, lean mass or muscle mass loss, and then functional ability. So let's start with strength. I think one of the most robust lines of evidence, if someone asked me, what's one of the main reasons you would consider creatine in addition to your exercise program, I say it's an improvement in strength, primarily the upper body. So the best lines of evidence suggest, yes, you get an improvement in muscle performance. There's better evidence in the upper body versus lower, and we can talk about that from an aging phosphocreatine perspective. What hasn't been shown, and this might be ironic to the viewers, is when we say muscle, what we really are meaning from studies is lean mass. The problem with measuring lean mass is 50% is usually skeletal muscle, 50% is water, connective tissue, organs, things like that. So at the end of the day, creatine in combination with weight training has only been shown to increase lean mass by about 1.5 kilograms. So at best, we're putting on maybe 700 to 800 grams of muscle. Now, to a young individual, they're like, what? That's not very much. Keep in mind, at the age of 40, you start to lose skeletal muscle. And then not only can creatine and resistance training maybe halt that, I think an older adult would say, I'm buying that. If you can give me 500 grams more of muscle, that can improve functionality and the performance of activities of daily living. And those two improvements are correlated with meta-analysis showing that creatine and exercise improves sit to stand and 6-minute walk. So I think overall, creatine sort of got its press in the older populations, if you will, by improving all three facets there. It also has some small effects on limb muscle thickness by measuring ultrasound or PQCT in the upper and lower limbs there. So overall, I think if an older adult, 50 and above, was thinking of taking creatine, those are some small beneficial effects they should at least experience in addition to exercise alone. I think the key, though, is that exercise is a driving force. There's only been a handful of studies of creatine without exercise that have any beneficial effects in clinical or older populations. Those are primarily coming from disuse, atrophy, immobilization. But what about bed rest? What about older populations in the hospital, post-surgery? These are all areas of research that definitely need to be looked at.
I suppose, I'm thinking about power, right? Power is the other reason in terms of people start aging, and power is one of the main reasons that, in terms of not being able to catch yourself from a fall or miss a step when you're going. I suppose if it's strength times velocity in force production, with that respect, it would help. But has creatine been shown to or mitigate the reduction in power over time as well?
Not specifically from a functional task, but when it comes to an isolated type of equipment like an isokinetic dynamometer, yes, it has. So Jeff Stout's done a few studies in the inception of creatine research looking at that as well. Our lab fails to find a decrease or an improvement in power. We typically use vertical jump or a medicine ball throw and measure the distance there. So these are subjective measures. So I think it comes down to the measure or how elegant it is that you're assessing. But there is some evidence to suggest that it not only maintains power, but it can improve it. We don't see that in our lab, but it might be based on the type of assessments we're doing.
So given we're talking about the aging population, how does anabolic resistance come into play here?
So it's a very interesting fact, and it's debatable, but we do know that as we get older, we have a blunted response to two things: resistance training and dietary protein. So that's where this aging anabolic resistance comes to play. There's researchers out of Texas who would argue that if you maintain exercise your entire life, you do not get aging anabolic resistance. So it's not inevitable. So anybody listening, if you're young, please exercise and eat high quality protein as often as you can. But the theory here, and then if we bring in creatine, is there is some evidence, especially in the lower limbs, that the larger muscles of the quadricep have reduced phosphocreatine kinetics or stores. And those are the muscles you typically use, during leg press, sprinting, squat. The lower limb muscles of the gastroc seem to be preserved compared to the young individuals. Those are the ones you use walking and minimal activities of daily living. So is anabolic resistance contributing to creatine or vice versa? We don't know. I think it likely means that older adults might require a small bit more compared to a younger individual. And that's why some of our best lines of evidence have used a higher dose of creatine and shown more favorable effects as we get older. It makes sense. As muscle is deteriorating, especially type 2 muscle fibers, that's where creatine is stored. Maybe older adults need more to compensate for those losses.
Do you think with anything like the 6-minute test, a lot of that is also just the improvement from the cognitive standpoint? And I'm just thinking out loud here, especially when you're talking about the upper body having more of pronounced effect compared to the lower body.
Yeah, it can. The other thing that comes to my mind, that's a good point, is the cardiovascular improvements we're starting to see now with creatine supplementation. But you're right. I always envision, the cognitive effects near the end of a stressful spin class, whichever. Could it come into play? We don't know yet, but I'm envisioning, at the World Cup in 5 minutes to go for the World Cup championship, those individuals are so fatigued. Could creatine have help? I don't know if you watched the Ryder Cup this year in New York, but McIlroy looks so exhausted on Sunday, and he's come out publicly and say he takes 20 grams a day. Could that situation where he was so mentally fatigued cause an individual to take him maybe 20 or 30 grams to cause him to play better against Scheffler on Sunday to win? We don't know, but you could tell he just looked so tired. And this is a professional golfer making hundreds of millions of dollars a year. So it goes to show all the money in the world can't overcompensate some of the detrimental effects of fatigue. If he's listening, maybe he's going to take more next time for the Ryder Cup. I don't know, but I envision certain big events. I think of the Boston Marathon or something that must be so daunting cognitively. Could creatine at least be one small tool in the toolbox to look at those effects? And I'm very excited and curious to see where this is going to go in the future. Yeah.
I'm thinking about what you mentioned earlier in terms of those who are avid exercisers throughout the entirety of their life tend to have less of those issues from anabolic resistance. But I'm thinking about, some people might be avid exercisers, but maybe they're just runners and they're not as much into resistance training as opposed to me, who I hate doing long distance steady state cardiovascular exercise, but I love strength training. And we know that, with respect to the former, you're going to have more type 1 muscle fiber. So for that type of person, as they are aging, should they be taking even more, given that maybe type 2 is where more of the saturation is going to be happening? Or is this me getting a little too much into the weeds here?
No, it's 100% valid. That's where the best evidence is pointing. So let's look at the evidence in long duration cardiovascular exercise, which is extremely catabolic. For those listening, resistance training is actually not that catabolic to the cell because the body is so acute. But if you go out and run 4 hours straight, that's detrimentally catabolic to the body. So you're going to be in a net negative protein balance. And a few studies have shown before an Ironman or ultra marathon, taking creatine 5 days before substantially reduced inflammatory cytokines. So creatine had this anti-inflammatory effect, potentially allowing the body to recover quicker. And then when you look at the aging population, they're already having elevated amounts of oxidative species, inflammation, or low-grade inflammation causing sarcopenia. Maybe taking a smaller amount will allow their body to at least recover quicker from that type of exercise. So you have heart health and, of course, other aspects of beneficial effects of weight training. So I think there is enough logic to suggest that creatine can be elevated in certain populations. And when we look at the safety profile, it's exceptional. So at the end of the day, I think having a little bit more is advantageous, if anything.
So we touched on brain, bone, muscle,
Yeah.
right? And let's talk heart.
Yeah.
How does it play with respect to the cardiovascular system? Does the heart makes its own as well? Yep. Is my understanding correct?
It's exactly the same. Now, the heart is a little bit different because unlike skeletal muscle, the cardiovascular system is not, so it's going to be taking it up through circulation. So basically the liver and the brain are the only two endogenous organs making it. The rest would be taken in. And there's not been a lot of research on the cardiovascular system because, creatine was thought to be part of the anaerobic alactic system. Why would someone utilizing the cardiovascular system use it when they can rely on glycogen and adipose tissue and protein? But the recent research is suggesting from a cardiac rehab perspective, where heightened elevations of inflammation, that creatine can improve endothelial function, vasodilation, and maybe have some heart health benefits. So that is an interesting area. I think it's emerging for those that are involved in cardiac rehab to look at the pathophysiology or how creatine can be added to a rehabilitation program for some individuals. So it's not a lot of research out there, but the evidence that I've seen is very positive.
That's us, Darsh. Cardiac rehab. That's our world. So
all of it. Yeah.
I guess it necessarily wouldn't be improving contractility or anything in that sense with muscle like power or like, because it's not necessarily strength in that sense, but you're saying it's more vasodilation. So just getting better blood flow, almost like a nitric oxide would work as supplementation.
Yeah, and that's where arginine, one of the main 3 amino acids part of it, comes from. Now, I will say that some of the meta-analysis suggests that creatine supplementation in young populations, it has no effect or it actually decreases absolute VO2 max. So I don't think you're going to be taking creatine to improve your maximal ability to use oxygen. We did a study during HIIT training, and creatine failed to find a beneficial effect there as well. So I'd like to see more research in this area, looking at the mechanisms of different types of cardiovascular exercise. The best lines of evidence come from long duration. But in theory, you would think spin class and HIIT class would be right up creatine's alley, using the anaerobic alactic system, multiple sprints. But right now, it doesn't seem to have any effect. If anything, it fails at those systems. But more research would have to be done in those areas,
Interesting.
Awesome. Darren, can we get into dietary preferences?
Yeah.
So Myself, I'm a vegetarian. I've been taking creatine for a long time now. One of the most common questions I get asked is, how do you have muscle? I don't know. Maybe it's genetics. Maybe it's creatine.
Yeah.
Who knows what it is?
Right.
What do we know based off how much creatine people are consuming based off a omnivore diet, and if they get meat versus obviously those that are not eating meat?
Well, first off, vegans probably respond the best in the world, the second best in the world to creatine supplementation. Those born with an inborn synthesis deficiency would be first. Those on a carnivore diet would likely experience the least benefits. So from a vegan perspective, just think of your muscles half full of creatine. And the only reason I say that is the only area putting creatine in there, because you're not eating it, is the liver. So you're producing maybe 1 to 2 grams a day from 3 amino acids, arginine, glycine, and methionine. Now, those eating a carnivore diet where they're eating a lot of creatine through red meat or seafood, they're going to be taking a lot more. We don't think that suppresses the liver from making it. We don't know if it suppresses the brain from making it. But at the end of the day, if it does, it would come back to baseline once you stop, either through diet or supplementation. So numerous studies have shown vegans respond exceptionally well to supplementation. You're kind of having more room in the muscle to get a benefit. We don't know the effects of creatine with vegans on bone. And there's a few studies showing that vegans respond very well to creatine supplementation. Carolyn Ray has done that. But the best study, and this is kind of interesting, was done in Brazil a few years ago, that vegans and omnivores have the exact same creatine levels in the brain. So that validates that the brain is making its own creatine. It doesn't need to rely on what's through circulation. From muscle, totally different. So I think vegans would respond exceptionally well. The people who likely wouldn't is they're either making a lot endogenously through genetic factors. They have either a preference from the diet of taking in a lot of red meat or seafood. The issue, though, is you would have to eat almost a kilogram of seafood or red meat to get about 3 to 5 grams. So financially, ethical treatment of animals, whatever your preference, it can be very difficult to do. We've been talking about, 5, 10, 20 grams. That's why I think supplementation is so viable and attractive for some people. But that's an important distinction. Creatine technically is not essential. If you're naturally making it, it's not essential, like an essential amino acid. So the nice thing here is that you do not need supplementation. But if you do take a little bit more, that's where some of the benefits seem to come into play.
Is there creatine in any dairy products? Because I just want to distinguish vegetarian and vegan as well. So vegetarians are getting a little bit more creatine just through
trace amounts. You would have to eat or drink all the milk from a Jersey cow to get any significant amounts. Poultry and poultry would have the lowest concentration. Fatty or fish has the highest concentration.
And then after that would be red meat.
Oh, sorry. Yeah. So fatty fish, beef will be right up there as well. But herring, mackerel, fatty salmon, natural will have the highest concentrations per serving. So, a salmon steak and a half would give you maybe 3 to 5 grams of creatine at best. A large steak would as well. A couple chicken breasts might have an accumulation there as well. So it's not impossible. But if you're thinking I need 10, 20 grams, it's difficult.
Yeah.
We typically say supplementation in addition to diet. No study has ever looked at, okay, what are you eating? Then we'll just make up the difference with supplementation. And I think that's a very interesting question there as well.
Sure. Interesting. Yeah, because I guess none of these studies are actually checking endogenous, right? We're just checking.
That's right. So you'd have to measure your baseline intramuscular stores, but we don't measure what the brain and liver are making. Yeah. And then we can't measure the suppression. So again, you're sort of juggling what we're eating, what we're making, what we're supplementing, and just seeing the effect compared to placebo. Yeah.
Are there any tests people could do in terms of genetic markers or look at specific SNPs that would suggest that you are not necessarily hyper responder, maybe actually even a hyper responder creatine, but also are you an overproducer with respect to endogenous creatine production, or if you have suppression? I know you mentioned there are specific genes that people will have those enzyme deficiencies that I'm sure you can check for. Yeah. But nowadays, people have access to their 23andMe data and all these things. Are there certain SNPs that you could look at?
Not SNPs, but you definitely look at the 2 enzymes, and then you would measure the amount being naturally produced in the liver. The brain, you'd have to do an MRS study for that and see the effects. And you'd have to do it longitudinally to see the effects over time. We could estimate what you're getting through the diet, but really you would put people in a metabolic ward, feed them a creatine-free diet, see the effect there. So you'd have to do a lot of work. That would be a randomized control clinical trial in a metabolic ward. Yeah. So tough to do. Yeah.
That's tough to do. So I want to talk about creatine in kids. I have to thank Darsh for pointing me to these delicious gummies that I'll use from time to time. And my daughter will ask me for these gummies that I have, and I'll give it to her. But my wife will look at me like, "What are you doing? How dare you?" Like, she's going to be 4 in a couple of days.
Okay.
And to my knowledge and my reading of the literature, there's really no problem, especially because we've talked about everybody's making it. Right. So what can you educate the listeners on with respect to creatine supplementation in kids? And I mean actual children.
Yeah, there's a handful of individual studies and a few great review articles by Chad Gersick and Andrew Dagom of the United States. And based on all the data, there's no adverse effects currently with creatine supplementation at recommended dosages. And actually children, just like adolescents, get improvements in agility, balance, improvements in body composition. Serge Osiak has even taken it a step further and looked at Ann Haynes data. And if you're getting 1 gram of creatine or less, that can have some detrimental effects for childhood development from bone, speech, as well as muscles. So the minimal threshold seems to be about 1 gram per day in the diet. That's kind of easy to do unless the child is very picky of an eater, or you can get it through supplementation. So right now we're not seeing any adverse effects. No reason why a child can't take small amounts. You could do 0.1 gram per kilogram of their size. Well, if the child's a picky eater, that could be difficult too to get enough creatine. But right now, we're not seeing any adverse effects. If anything, there's beneficial effects. And again, obviously, as a parent, you want to talk either to your GP or look at the evidence-based research there. And I'll piggyback this a little bit further that we're starting to see an evolution now that there's benefits for creatine during pregnancy, transfer of breast milk, maternal milk to the fetus. Now, that's primarily been shown in the mouse and sheep model. But Stacey Ellery is the leader here from Australia. And if you're interested in pregnancy and creatine, just search her name. She's got some really good review articles out there. I'm not a medical doctor. If you're thinking of pregnancy or anything like that, please talk to your medical practitioner. But again, there is some potential benefits. And she's doing the first randomized control trial right now in females looking at the effects of creatine there. So, we used to just look at creatine on young biological males. Now it's gone all the way left to females, pregnancy, all the way up to the elderly populations. So from an age perspective, we're starting to see evidence in all aspects.
I'm curious about the formulation of creatine, right? Altamash talked about gummies. Recently listened to Rhonda Patrick and Peter Attia talk about gummies. Do we know if those can be standardized? Like, are we actually getting 5 grams in those gummy formulations?
Yeah, we don't specifically know from a peer-refereed publication yet. I know there's been some talk on social media. But I will preface this, and I'm sure those studies are coming out, but in 2003, the late Roger Harris, did a really classic study where he looked at meat versus creatine in solution versus creatine in candy. And when he looked at all those 3 sources, creatine did get into the bloodstream. They were at different rates, but all 3 were very bioavailable. The area I'd have concerns with is creatine in an acidic environment for a long period of time, because I think the pH will interfere with creatine stability. It'll probably get broken down to creatinine over time. But until those studies come out, we're still speculating. I would venture a guess where creatine in gummy is a solid form. I don't see any reason why it wouldn't be a bioavailable source based on Roger Harris's work, but I'm very eager to see those studies come out. Yeah.
Gotcha. Very cool. Okay. And then I think most people take a powdered form. I mean, that's what I do. We've always heard monohydrate now is probably the best to take.
Yes.
There's also something called Creapure. Can you explain what that is? I know it's out of Germany, but people may see that on the bottle.
Yeah, so it's the world's most elegant type of creatine monohydrate. So Creapure has GRAS status. It's the only type of creatine that is primarily found in most reputable companies. But creatine monohydrate is the form of creatine that is the safest, most effective. Creapure is a form of creatine monohydrate that undergoes rigorous testing. There's 2 areas of the world that primarily produce it, Germany as well as China. But Creapure is the one that's been purified and from a safety and efficacy standpoint used in a lot of randomized control trials.
Amazing. Darren, any other areas that we haven't explored that you're excited about with respect to clinical stuff outside of that was tried and true?
Yeah, so the areas that I'm super excited for, more work on the brain. A great study came out on Alzheimer's disease this year. It was a groundbreaker, showing 20 grams a day for 8 weeks improved symptoms of Alzheimer's. We're now starting to look at diagnosed dementia. What about females across the lifespan? We don't really have much work in the perimenopausal area. It's so often overlooked, but what about young females? So premenopause, peri, and then post, we got to look at those areas as well. The anti-cancer properties is a main area of interest for me. I'm partnering with a great colleague in South Carolina looking at breast as well as prostate cancer. Can creatine's anti-inflammatory effects be important there? So those are 3 of the big areas. I think the one that we can talk a little bit about is any of the other myths that you're viewers come to. If you look at me, I don't know if people can see me, does creatine cause baldness? We're not seeing any evidence for that. I was going bald before. I think as you guys being medical practitioners, you probably still get the creatine and kidney dysfunction question all the time. And I think a lot of viewers say, I take this blood requisition form, my doctor checks off creatinine, they don't care about creatine, and right below it is EGFR. And lo and behold, I forgot to tell them I was taking creatine supplementation. And when creatine enters the bloodstream, it gets locked into the muscle. And when it's metabolized, it doesn't leave as creatine, it leaves as creatinine. And so if you have elevated amounts in the blood, it's a false indication of kidney function. So anybody listening, if you're thinking of increasing diet or supplementation, make sure you tell your doctor that you're on creatine supplementation. It's likely going to elevate your creatinine levels a little bit more.
What about caffeine with concomitant use with creatine? Because one thing I stopped doing was actually taking creatine with my pre-workout, but then actually learned that it was probably a myth.
Yeah, so it's an area of controversy. We still don't know. So I'll sort of give you two avenues. The best studies that show there's an interference effect of calcium being released from the sarcoplasmic reticulum. For those listening, they go all the way back to high school biology, but caffeine likes to release calcium to troponin, and then your muscles can contract. But at the same time, creatine likes to take it back in so it can be recycled quicker. So we think caffeine and creatine might act as tug of war, but that's only from a muscle contractile property principle. Excellent studies out of the UK, as well as I believe Germany, has clearly showed that 350 milligrams or more of caffeine powder interferes with some of those effects of creatine. But most beverages, teas, coffees, even energy drinks do not have 350 milliliters of caffeine. So I'm confident that if you mix it in your tea, cola, whichever, that's fine. If you're starting to notice that you've been doing that for a long period of time and you're not noticing any beneficial effects either from the caffeine or creatine, you may want to split those up. We don't think caffeine and creatine interfere with each other from a pharmacokinetic perspective. We definitely don't know, and when I say caffeine, that's the powder, we certainly don't know if it interferes with coffee. And we're actually doing that study now at different dosages there. So if you'd like to throw it in your coffee or tea, go ahead. If you're getting results, great.
Well, Darren, this has been amazing, man. Thank you so much. Like I said, I think that, not too long ago, myself and a couple of students, we actually sent a survey out to a lot of the primary care colleagues in this area just to understand their perceptions on creatine. And you're right. They still have this idea that creatine is going to be problematic for the kidneys. And that's the main one. In fact, I'll say this. I think I remember you talking about us talking to nephrology with some of the things. And when I was an intern, so this was circa 2017, I remember talking to a nephrologist about why are we not using cystatin C as a marker for kidney function, particularly in individuals who have high amounts of muscle mass, are using creatine or just active, because we know that creatinine it's going to be an indicator for muscle mass and just muscle turnover, not necessarily just creatine supplementation. And you're always going to have falsely elevated GFR. And oftentimes, myself included, it looks like I'm in stage 2, stage 3 kidney disease, depending on where I am, if you look at GFR. And, he gave me some nonsensical explanation that absolutely made no sense. And I think these things are really, really hard to break with tradition, particularly in the States. I know Canada has a slightly different system. So my hope is that we're going to be able to share this to some of our medical colleagues. You're doing some amazing work. You're constantly publishing. You're at the forefront of research and really pushing the boundaries with respect to our approach to how this, I guess, gym supplement is being talked amongst individuals and from a medical sense, like we did today. So where can our listeners connect with you? Where can they stay in touch with you? Can they reach out to you if they have questions or anything like that?
Yeah, I think the common ones, I think Instagram is the most popular at Dr. Darren Candow. Same handle for Twitter and LinkedIn. But Instagram seems to be the area most people come to me for questions or publications. And we have a lot going on. We're going to be looking at creatine and concussion. We're looking at creatine and hip fracture. And then we're looking at different dosages. Do smaller, more frequent dosages throughout the day have any different effects on bolus dosages? So there's lots going on. We currently have 7 studies ongoing in the lab, and we're always trying to publish quite a bit. So yeah, maybe I'll come back in a year and we can do an update and see what's out there.
Actually, Darsh, real quick, actually, the concussion piece, this is a selfish question. So what's interesting is that, I mentioned we did sports medicine. I think for most folks training in sports medicine, we train a lot of sports related concussion. Creatine is actually one of the things that we'll recommend somebody immediately in the acute stages after concussion. The part that I almost always certainly mandated, and I use that term very loosely, is when I see these post-concussive syndromes, right? So or persistent concussive syndromes a year out, 2 years out. the one thing that I struggled with before this, I was always recommending 5 grams. And my question is like, are there any specific studies looking at those prolonged miserable minority type symptoms? And if so, like how long can somebody supplement for? Are we still looking at 6 months, or is that data still coming from that Parkinson's stuff that you talked about?
Yeah, the only data we have in long term is in retired NFL players. And unfortunately, they have a decrease in brain creatine levels, opposite correlation with head trauma. So the thought here is I agree. I now think anybody involved in head contact sports should at least be educated on some of the beneficial effects of creatine, taking it before and then, of course, immediately after. We don't know any of the long-term effects there as well, but these are large-scale clinical trials which need to happen. Hopefully, we're going to start one very soon. And also look at populations that have symptoms. Maybe, it's never too late. Maybe you start doing studies where you get people to volunteer 1 or 2 years in if they're still having symptoms. That's what we've done with long COVID, and see can creatine provide any benefits even longer term down the road. So I don't know if it's ever too late to start, just like exercise, but I do know that the animal model is definitely suggesting that if you take it before head trauma, it will decrease cortical damage. Can that improve symptoms of concussion? And in the only study looking at traumatic brain injury was in children. And when these children suffered head trauma, they took 0.4 grams per kilogram, so a very high dose on a daily basis for 3 and 6 months. They didn't measure brain creatine, but these children had improvements in speech, self-care, a decrease in fatigue and headache. So I think we're starting to see some evidence to at least consider this if you're susceptible to head trauma, or God forbid, if you do suffer it, at least talk to your doctor and say, hey, I think there's something with this creatine. It's not going to have any detrimental effects. If anything, the upside is there.
What was the average age range in that study that you're doing?
They went from 1 all the way up to, I believe, 18 years of age. So wow. It was quite a wide range.
Yeah, big variety. Okay, cool.
Wow. Well, Darren, there's 2 things I'm thinking about right now. The first is how do we get Rory McIlroy to be a listener of the show? Right. Now that you mentioned it. But the second thing I'm thinking about, man, is everything we talked about today. I mean, every single one of my patients is a classic example of everything you talked about: sarcopenia, brain health, brain injury, stroke. And just waiting for that day where we can actually hold it in our hospitals and, treat our patients with it. So that would be fantastic to see. You're obviously in Canada. We're here in the US, but irrespective, I mean, there are healthcare atrocities, if I could say, across the world. So the last question we ask everyone is, how do we put the health back in healthcare?
Oh, that's an excellent question. I think the biggest thing is awareness. I think there's a lot of stigma, as you guys mentioned. It was hard to even get doctors to understand the evidence-based research on creatine. You're all trained in a certain pathology and pathophysiology, but I think the awareness is getting health back there and understand that there's alternative forms. I think exercise and proper nutrition are 2 of the areas that we often overlook, but those are the areas I think we can at least do better with, especially in my area.
Perfect.
Amazing. Thank you, Darren.
Absolutely.
Thanks, Darren.
Okay.
Thanks, see you next year.
Absolutely. Thank you.
Thanks for listening to another episode of Medicine Redefined. If you enjoyed this episode, please be sure to check out some of the additional resources in the show notes. Please also check out our social media platforms where you can find more content like this. You can follow us on Instagram, Twitter, and TikTok at Med Redefined. We also want to thank our team for the production of this podcast, specifically Ethan Ju on video, Haritha Yepuri on social media, Zainab Lugmani on research, and Sarah Khan for newsletter. Also, if you enjoyed the show, please be sure to subscribe, review, and share with anyone who you think will gain value from this as well. Now, time for the ever so important disclaimers. This podcast is intended for general public use and is for educational purposes only. It does not constitute the practice of medicine, nor should it be construed as medical advice. No physician-patient relationship is formed, and anything discussed in this podcast does not represent the views of our employers. We recommend that you seek the guidance of your personal physician regarding any specific health-related issues.